Hi, my name is Sian Calvert. I'm a research fellow in the NIHR Nottingham Biomedical Research Centre at the University of Nottingham. I'm going to be talking to you today about a James Lind Alliance priority setting partnership in coexisting dementia and hearing conditions. To give you a little bit of a background about dementia and hearing, dementia affects almost 1 million UK adults. 1 in 2 of us will be affected by dementia in our lifetime. And dementia is an umbrella term which covers many different types of dementia. Hearing loss affects 12 million UK adults. Hearing loss can be sudden, but it's often gradual. And hearing loss can range from mild to profound. People can experience other types of hearing conditions other than hearing loss, for example, tinnitus, which can be described as ringing or buzzing sound in the ears, hyperacusis, which can be described as sensitivity to sound. So looking at the conditions together, dementia and hearing conditions are common in older adults and often can coexist. Untreated hearing loss is the largest potential modifier risk factor for the development of dementia. The symptoms of dementia and hearing can often overlap. For example, difficulty with communication and concentration, making diagnosing and managing these conditions challenging. We know there's a link between dementia and hearing, but there are many unanswered questions. For example, is dementia related to tinnitus, so ringing or buzzing in the ears, and hyperacusis, sensitivity to sound? Can using hearing aids help prevent dementia or slow cognitive decline? What is the best way to assess hearing loss in people living with dementia? And what are the most beneficial treatments for coexisting dementia and hearing conditions? So what is a James Lind Alliance priority setting partnership? So a James Lind Alliance brings together patients, caregivers and healthcare professionals in a priority setting partnership to identify priority unanswered questions that are agreed are the most important, focusing on things, specific conditions or areas of health and social care, so research know what matters most to those the research will impact. The Coexisting Dementia and Hearing Conditions Priority Setting Partnership is the first to bring together two coexisting conditions. And the aims of this project are to identify the most important unanswered questions about coexisting dementia and hearing conditions to shape future research. And the objectives are to identify unanswered research questions about the prevention, diagnosis, and treatment, including self-management and management of these conditions, agree by consensus a priority list of research questions, use the prioritized research questions to shape future research commissions and policy. So who's involved? The priority setting partnership is supported by a James Lind Alliance advisor who will guide the process to ensure everybody has their say and the established James Lind Alliance process is followed. The priority setting partnership lead who will drive the partnership, the priority setting partnership coordinator who will oversee the day-to-day running of the partnership, a steering group who will oversee the process and make key decisions, a partner group who will help share information about the partnership with their networks, and the participants who will decide those top research unanswered questions. We're going to be following the established James Lind Alliance process, and there's some key stages. The first one is to establish a steering group, people with lived experience and those who support them to oversee the process. An initial survey to collect initial priorities from a range of people. These will then be collated and checked against published evidence to make sure they're unanswered. This shortened list will then go into a second survey where people will rank their top choices, and the top choices from this survey will then go to a final priority setting workshop where patients, carers and clinicians will come together to decide on the top 10 priorities, and then these will be disseminated widely. So this is some of the team overseeing the priority setting partnership. We have the James Lind Alliance advisor, who is Dr. Nahid Ahmed, the priority setting partnership lead, Dr. Etna Heffernan, and myself as the priority setting coordinator. We're very lucky to be supported by the Dementia and Hearing Research team at the University of Nottingham as well. So the steering group, who will oversee the priority setting partnership, has been formed and is made up of clinicians, people with lived experience, dementia and or hearing conditions, somebody who supports or cares for a person living with dementia, and hyperacoustics expert, and representatives from user organisations. The partner group has been procured, and this group will help share updates and the survey with their networks. This is made up of researchers, clinicians, representatives from the Department of Health and Social Care, a public and patient and public involvement lead, a Cochrane knowledge broker, and a co-production expert. The first survey has been developed and will collect initial priorities about the prevention or risk reduction of the conditions, diagnosis and treatment, including management and self-management of coexisting dementia and hearing conditions. We would like a range of people to complete the survey, and this includes people living with dementia, people living with hearing conditions, those that are supporting, for example, relatives or carers, healthcare workers, social care workers, and the general public. If you would like to get involved or take part, if you'd like to take part in the survey or would like updates about the priority setting partnership, please visit our webpage on the James Lind Alliance website. You can also follow us on the platform formerly known as Twitter, or you can access our Facebook page. We would like to thank our funders, so the NIHR Nottingham Biomedical Research Centre, Alzheimer's Research UK, and the Royal National Institute for Deaf People. And I'd like to thank you for taking the time to listen to this presentation. And if you've got any further questions, please do get in touch.